Good morning, everyone. I'm Delia Gonsalves from WUSA 9, and I am so happy and proud to be here with my friends and dear loved ones from Community of Hope celebrating an amazing day, and the weather cooperated, didn't it? You know, as I was walking around, I really love hearing all the conversations and the laughter, because this celebration is all about family. It is all about hope. It is all about new beginnings and new life. And I am proud, and it is my privilege to announce, speaking of new life, that Community of Hope's first baby born here at this location welcomed himself into the world at 1 a.m. So the first baby was born at 1 a.m. this morning. You know, I feel like being a mother of three, I feel like these babies in utero have a mind of their own. And I think that baby knew today was going to be a big celebration. So that baby born in a room overlooking this parking lot at 1 a.m. this morning, and because of the support and resources of the folks here at Community of Hope and at this center, the birthing center, baby and mom, healthy, loved, supported, were able to go home in 4 hours. Today we are welcoming hundreds of friends of Community of Hope, partners who've built these walls, artists who've adorned them, staff who've worked tirelessly, donors who've given generously. Starting this morning and continuing all day long, we are welcoming patients and community members who've long awaited a new health home here in their neighborhood and are making a big transition to this new location. Now, some of you I know haven't had an opportunity to go inside and see this beautiful facility. After a short program today, we will have an opportunity to hear from Kelly, our mayor, funders, financiers, and a board representative. Everyone will have a chance to go inside and see what I just saw. A facility, and I want to say who, because really it personifies what Community of Hope is all about. When you walk through those doors, it is like a family member wrapping their arms around you. It is a warm, inviting space with beautiful art on the walls. Art, I think, that will probably serve as a healthy distraction when a mom is in labor. But it is just a beautiful space, and you really can envision the hope and what the possibilities are when you walk through that space. And so, and I spent some time in the old facility, and it is night and day how much more room you have here and how many more families you can serve. It is really exciting, and it almost makes me want to have a child again. Almost. Not really. This is going live, and my husband will watch. No, it's not. Don't worry. Babies will be born here. Trauma will be addressed through counseling. Chronic diseases will be managed. So let me now introduce you to Kelly Sweeney McShane, Community of Hope's president and CEO, who can tell you more about this amazing vision. Kelly has been leading this organization for 21 years. Now, in this time, yes! You know, I am so honored to know folks like Kelly and other folks in the community who are really personify the commitment and the passion and the love that it takes to wake up day in and day out and continue this work. And I'm so happy for you and so proud of you, and I thank you so much for the good work that you're doing on behalf of all of us here in the District of Columbia. Kelly, in this time, the organization has grown to over 10 times the number of staff and people served. In the last 10 years, this is the 4th capital project, one in every quadrant of our city, and that is something to be celebrated. Community of Hope has expanded to ensure that each community has key health and community resource anchors available to ensure equity for all Washingtonians, no matter what your zip code. Thank you so much, Kelly, for all that you and your team are doing for our city. And with that, please come to the stage. Thank you so much. Round of applause.
So good morning. Oh my goodness. It is so wonderful to see so many friends and family. Can you guys hear me? Okay, good. Here as we celebrate the grand opening for the Family Health and Birth Center. So Community of Hope has a bold mission. Our mission is to improve health and to end family homelessness in order to make Washington, D.C. more equitable. And this work cannot be done without this important location of the Family Health and Birth Center, or FHBC as we call it. So FHBC has been an anchor in Northeast DC since about 2000, and I'm really grateful to the Developing Family Center and Dr. Ruth Lubick and Dr. Linda Randolph, who had the vision to establish FHBC. Community of Hope became involved about 11 years ago when we merged with FHBC, and we're able to really continue the strong midwifery and pediatric services, as well as adding primary care for the whole family and emotional wellness services. So about 7 or 8 years ago, though, we learned that our current location at 17th Street, our former location of 17th Street, was being sold. And so we needed to find a new home. And we knew how important it was to continue our services, and certainly especially during the pandemic, knowing how important it is to keep these primary medical home access points available. We also knew that we wanted to stay close to where we were so that we could continue to serve our historic patient base as well as expand into new communities. So as difficult as this move, it's never fun to move and pack up and reorganize and everything else, this has been a wonderful opportunity for really to continue our work, but also to expand and think broader with a bigger and bolder vision. So I want to tell you a little bit about our vision for this center. First, we really want to continue to ensure we're an anchor for primary medical care for the whole family. So that's the family health part of Family Health and Birth Center. For men, women, seniors, teens, babies, everybody can get their full primary medical care here. We're going from about 8 exam rooms to 14 exam rooms, which will allow us to increase our patients by about 25% over the long term. We also want to make sure we have more services to support emotional wellness. We now have 6 consult rooms, including 2 that are set up for play therapy and evidence-based parent-child interaction therapy. And we know that loss and trauma impact children and communities significantly, and so we really want to be here as a place for healing and hope for those who are impacted by that. We're also excited to continue our very strong maternal and child health programs. Those include our midwives, our doulas, our care coordinators, our home visitors, our lactation consultants, and the birth center as well. And yes, babies are born here. Several men were asking me like they were born here. Yes, they were born here, and then they went home, and it all went great. We are the only freestanding birth center within the District of Columbia. And then last but not least, in terms of our services, we're adding a pharmacy. We've never had pharmacy before. So we're excited to be able to provide on-site, same-day prescriptions, as well as mail delivery and special delivery to make access more accessible for pharmaceutical services. We're partnering with Maxor in that endeavor, and we're looking to fully open later in the summer. So stay tuned for when that all gets fully operational. Another important part of our vision was to really utilize local artists and artists who are people of color. So you'll see throughout the building beautiful art that reflects our staff and our patients and is made by artists who also reflect our staff and our patient base. And last but not least, we also really wanted to make sure we were supporting local businesses. And though this wasn't required by any of our funding, we voluntarily and intentionally worked to hire community-based enterprises, and 20% of our construction outside of the acquisition costs were done by local CBEs as well. So all of this would not be possible without many, many hands, many of whom, all of you are here today who've been involved to get us here. I think it's taken about 5 years or so. So I'd like to take the opportunity to thank some of who are involved. I'd like to start with our development team because we spent a lot of time together in the last couple of years. And particularly give a shout out to Deara McKinney of Rosewood Strategies and Alexis Blakely McKinney and Kevin Brown of Montage Solutions, who've been awesome to work with. Our regular Thursday mornings, I don't know what I'm going to do now, instead of our weekly calls. Forrester Construction did a wonderful job as our general contractor. You give a wave if you're here. Gensler, the team at Gensler is our architects, and I know I saw Tammy here, designed a beautiful building, if you guys can give a wave. And then lots of engineers who made sure the building's going to stand and work well, including GES for mechanical and electrical, AMT for civil, and SGH for structural engineering. So thanks to all of you. We also had a very strong legal team, including pro bono support from Venable and also from Peter Freeman from Freddie Mac. I'm not sure if they're here. And then our New Markets Tax Credit team of Maynard Coopard and Klein Hornig. So speaking of New Markets Tax Credits, something I learned a lot about. Woo. Literally, this project would not have been possible without the New Market Tax financing for this project. So you will hear shortly, but really want to thank J.P. Morgan Chase, City First Bank as our lender, Harbor Bank of Maryland, and Partners for the Common Good for all of their financing of this effort. I know, y'all getting tired of clapping? We're getting there, I promise. Thank you. A huge thanks to our donors. We had over 340 people and institutions contribute, raising over $12.3 million to make this building possible. I see many of you here, but just to name a few of the top ones, in terms of number, not in terms of my heart. How's that? Includes A. James and Alice B. Clark Foundation, shared our vision, came in early, helped us purchase the property and do all the pre-development work. And why don't I go through all of them, and then we can applaud them all at once, if that works. Ruth Fisher Pollard and the Developing Family Center and Board, who made a generous pledge to this building. The Health Resources Services Administration, HRSA, through the federal government, who gave money towards furnishing and equipment. J. Willard and Allard S. Marriott Foundation, Diane and Norman Bernstein Foundation, Every Mother Counts, the England Family Foundation, William J. and Dorothy K. O'Neill Foundation, the Philip Graham Fund, the World Bank, and many, many other donors, including some anonymous donors. So thank you so much to all of you. We could not have done this without the wonderful board and staff at Community of Hope. So I'd like to particularly acknowledge the Community of Hope board. You guys give a wave, as well as the board of the new nonprofit entity we set up, the Bladensburg Road Health Partners, and we've got some board members here as well who serve there. You can quiz them all on New Market Tax Credits afterwards because they understand it all. We thoroughly explains it. In terms of staff, so many staff have been involved. A couple I'd like to particularly recognize, and I hope they're there, is Ruth Schickel, our Special Capital Projects Coordinator, who did everything. And then Derek Sykes, our Vice President of Finance and Operations, and Leah Garrett, our Vice President for Development and Communications. But so many team members who are here who are amazing. If you guys could wave your hands, jump up and down. You're mainly wearing blue. Thank you, thank you. Let's give my amazing staff a great round of applause for all they do every day. While they cannot be here today, Council Member Kenya McDuffie was also incredibly supportive throughout this process, as well as Council Member Gray, and so we're thankful for their support. And then, last but not least, we had some wonderful partners within the DC government who worked together with us to ensure that we could finish on time and on schedule. Particularly grateful to staff at DenPed. I think I see David Selman here, as well as DC Health, acknowledged Director Nesbitt, who's here with us, and working with SHPTA through the Certificate of Need process. So we opened about a month ago. And I just have to say, my heart has been so full as we see this building full of staff and people and babies. And as Delia said, just such a sense of joy and life and hope and healing. I'm really looking forward to making our full vision come to life and things that we haven't even dreamed of come to happen within this new building within the upcoming years. So thank you very much. Okay. So with that, I also want to recognize and acknowledge and thank Mayor Muriel Bowser, who's here with us today. I'm going to say one more thing about you. Mayor Bowser has been an incredibly strong leader through COVID, along with Dr. Nesbitt, and making us get through this whole period healthy and healthy and sane as we possibly can. So grateful to that leadership, exactly. But also a huge and strong advocate for maternal and child health. A lot of your investments around care coordination, doulas, home visiting, community of hope, uses all of those very effective interventions, and just are so pleased to partner with you to make sure that we have a healthy city and an equitable city. So I'll welcome you to make some comments. Thank you.
Thank you so much. Thank you. Well, good morning, everybody. I am delighted to be here. And Kelly, I want to thank you and your team and congratulate you on the expansion here. We are just delighted about your investment and even more connections that you will make with Washington, D.C. residents and women. 4 years ago, we put together our first Maternal and Infant Health Summit. And over that time, it has become the National Maternal and Infant Health Summit. We convene during the week of the Black Caucus, where we can invite national experts and policymakers to join in the conversation. That summit has informed a lot of investments that we're making in Washington, D.C., and a lot of connections among D.C. women. Dr. Nesbitt likes to remind me our experience with positive maternal and infant outcomes starts with well women. And there's a lot more to being a well woman than going to the doctor. Is having great opportunity in your city, safety in your home, safe transportation options, and affordable housing. That's all of the things that will help us improve our outcomes in Washington, D.C. And I don't know about you, but I want to invest in every aspect of making women well and babies healthy. I also want to acknowledge our incredible director of health. When I started as mayor, and I had worked with a number of health directors, and I said, I won't be recruiting a health director, although you have to manage the Department of Health. What I'm recruiting is DC's doctor. And I was so proud to have recruited LaQuandra Nesbitt back to DC. And I have been even prouder to watch her brilliance lead us through COVID. So please join me in acknowledging Dr. Nesbitt. So I know you've already talked about the facts that 700 women a year in the United States of America, the capital of the free world, die from complications related to pregnancy. And Black and brown women are 3 or 4 times likely to die from their desire to become a mom. But I know that the work that we do will not only address the very acute problems with delivery systems and access and cultural competency, but the bigger, decades-long or generations-long problem that lead Black and brown women to this disparate outcome. I am proud to be a part of a community that is working hard to change these statistics, and I know that we will do it together. I know some of you were together at Mama Toto Village in Ward 7 to highlight some of the resources that are available to moms in DC. and I couldn't make it then. I was in isolation then, but I'm happy to be able to be here today because we know that this work wouldn't be possible without our community partners and organizations that care and that is tailored to women of color, often provided by women of color. So, to the community of hope, congratulations. We're here with you every step of the way. We're also adding to our entire system of care, which I know is so important to all the healthcare providers. The doctor also reminds me the hospital is at the end of the line. The front of the line is right here at this center. So you know that we broke ground at St. Elizabeth's campus for the Cedar Hill Regional Medical Center, where we will have complete care for women delivering babies in Ward 8, and we're proud of that. I also announced the new HOPE initiative, where we will be partnering with Children's National, Whitman Walker, Howard University, and GW to apply for $92 million through the United States Treasury Capital Project Fund to address longstanding health disparities. Each partner will bring a unique approach to building a healthier, more equitable DC by creating new lab space, new technology, and new services. And so that will give us an opportunity to rethink how we do things, to go after root causes of the disparities that were laid bare during this pandemic. So with that, we invite you not only to celebrate today, but to continue to pull up your boots and you put on your gloves because we have more work to do. Thank you very much.
Thank you, Mayor Bowser, for your inspiring words and for your commitment to our community and for all the work that you do to advance maternal health. Good morning, everyone. My name is Jessa Lamine, and I'm the Executive Director of Community Development Banking at JP Morgan Chase. I'm honored to be here today to represent Chase in this wonderful celebration. On behalf of transaction leads and Jen Kim and Courtney Nolan, I'd like to extend a heartfelt congratulations to the Community of Hope team. Your passion and dedication is the reason that we're here today. Today is about the power of partnerships and community commitment. The opening of this facility is a testament to what can be accomplished when public, private, and philanthropic partners come together to support a community's vision. I'd like to take this moment to thank our financing partners. Some of these partners are here today. Carl Malloy from Harbor Bank Shares, Janine Jacobs from Partners for the Common Good, and Sonia Sanchez Wells from City First Bank. Your vision and your dedication to this community is unmatched. Thank you all for your collaboration. When we come together through business and community investments, we can open more doors of opportunity and connect more communities to the capital, resources, and expertise needed to turn the vision of the residents of this region into a reality. Community of Hope is that vision. At JP Morgan Chase, we strive to bring the full force of the firm to build a regional economy that works for everyone by providing equitable access and opportunity. We are committed to supporting economic growth and equitable inclusion in Washington, D.C. By the end of this year, we expect to open 70 branches in the region and have provided an additional $75 million in philanthropic commitment to the city. Additionally, we're pleased to advance the project like Community of Hope that is so strongly connected to our $30 billion racial equity commitment, which brings together our business, philanthropic, policy, and data expertise to help close the racial wealth gap and drive inclusive development. And we can't drive inclusive growth, economic mobility, or greater regional prosperity than showing up with greater intention and investing in the health of women of color. And that's exactly why we knew we had to get involved in this project. We need to address systemic inequities that put entire populations and communities at a disadvantage in our healthcare system. New market tax credits are a powerful tool in achieving this goal. These resources fill project financing gaps, enabling investors to provide more funding than would typically be possible. They allow us to invest in high-impact development with the potential to drive catalytic growth and help shape healthy neighborhoods where residents can thrive. We continue to advocate for the permanency of the New Market Tax Credits program with the hope that more permanency, communities such as this one can rely on this critical funding source on a more consistent basis. Throughout 2021, JP Morgan Chase provided over $500 million in New Market Tax Credit financing. And at the end of 2020, JP Morgan Chase proudly launched the New Market Tax Credit Racial Equity Initiative to spur growth and inclusion by benefiting Black-led and Black-owned projects, primarily serving Black populations. Community of Hope was one of the very first beneficiaries of this initiative, receiving an investment to fund the purchase, renovation, and expansion of this beautiful new home for its family health and birth center, which strives to improve the health outcomes of Black mothers who disproportionately face high infant mortality rates. Community of Hope has a bold vision for the future, a vision that we share at Chase. We look forward to seeing all of the great work that you'll be doing. Thank you so much. And now I have the pleasure of introducing one of our lending partners, Sonia Sanders-Wells, Executive Vice President and Chief Lending Officer from City First Bank.
Thank you. Good morning, everyone. I am thrilled to be here this morning, and I bring greetings from City First Bank, all of our executive management team, and Brian Argrett, our CEO. So congratulations, Kelly. This is fantastic. I am so thrilled to be able to be a part of this grand opening of this new family health and birth center. It's amazing. What a tremendous gift to the community, and City First Bank is proud to have been a Community of Hope's financial partner for the past 21 years. So really thank you. So thank you, Kelly, and your team for your business and for allowing us to be a part of this amazing journey. City First Bank is a community development financial institution, a minority-led depository institution, and a benefit corporation. And we have been supporting nonprofits and organizations like Community of Hope in the DMV and Southern California for over 75 years. We have deployed billions of dollars in capital for the creation of affordable housing and community facilities just like this one. We are very intentional and targeted about our provision of capital. We believe in economic equity for underserved communities and its residents, so we deploy capital to nonprofits and businesses that create, support, and champion these same communities and who believe in economic and racial equity and environmental justice. Community of Hope shares these same visions and is dedicated to improving health, ending family homelessness, and making the District of Columbia more equitable by caring for families, improving lives, and leading change. Together, we are Community of Hope. Have a wonderful day, and please welcome one of Community Hope's top supporters, Ryan Palmer of A. James and Alice B. Clark Foundation.
Thank you, Sonia. Good morning. I am so happy to be here today. I'm hoping I can make it through. I'm not supposed to have favorites, but this is one of my favorites. I'll be brief, and I'll just start with a blanket ditto on all of the wonderful things that have been said about this fantastic organization and their important work. When the A. James and Alice B. Clark Foundation launched the Parent-Child Health Initiative, we knew that Community of Hope would be one of our anchor partners. A leader in the maternal and child health field here in DC, this organization serves as not just a resource for pregnant and birthing people and their babies, but also as a source of primary care and support that nurtures the whole family. The Clark Foundation has invested over $100 million to date in our broader Parent-Child Health Initiative. Our investments are not only enhancing innovation and integration of health services, they are also enhancing collaboration between hospital systems and community-based health providers like Community of Hope. To see families walk through the doors of this striking new center and babies being born is a huge milestone for our vision of a DC where all children have the opportunity to grow, learn, and reach their full potential. Community of Hope has taken our investment and grown it into not only a remarkable facility, but a comprehensive and integrated healthcare approach where families will thrive. I've had the pleasure of working closely with this team over the past few years, and I want to extend my gratitude to Kelly, Ebony, Leah, Victoria, and the whole team here at Community of Hope. I'm so grateful for your partnership and your commitment to this work, and I can't wait to see what the future holds for this gorgeous facility and this incredible organization. Thank you. And now it is my pleasure to introduce Heather Wise-Reed, Community of Hope mom and board member. Heather will share her insights about this project from both angles. Heather?
So good. I'm a little shorter than everyone else. Good morning. So as she said, I am Heather Reed, and I am speaking today on my experience with Community of Hope. Not just as a patient or a board member leader, but also as a DC resident and most importantly as a mom. I first heard about Community of Hope almost 7 years ago while pregnant with my second daughter. It wasn't from a YouTuber or TikTok video or an IG reel. It was from word of mouth, a woman in my community. Her words were, if you want to have a birth plan that works for you, go to Community of Hope for your prenatal care. That was 7 years ago. Today, I am that woman, informing other birthing moms and families about where to go for good quality health care. This is where a community becomes a family. I know so many of us in this room have either given birth, witnessed someone giving birth, and trust me, it is not a time where you want to be labeled in a chart paper as a patient by your room number. However, knowing you feel comfortable, heard, and attended to in a safe, warm environment is my why. Why I continue to choose Community of Hope. Why I'm still here no matter which site I visit. I visit all the sites. Primary care or dental, I feel like I'm in a community. The dentist knows who the Reed family is. It's 5 of us. Ebony, Rebecca, Tracy, and Adrian are the names of the midwives who held my daughters while they took their first breath on their own in the Community of Hope Birthing Center. I remember Rebecca not being the on-call midwife, but still making her way to be a part of my birthing experience. Ebony saying, I get to catch both of your babies? Sheila Tank is the name of my daughter's primary care provider. It seemed like we played tag with our pregnancies. After every checkup and appointment, sometimes Dawn will share all the cool new things our kiddos have in common. The front desk staff, especially Keith, who's over there, and Sherry, they don't just know my family name. They know who we are. They are always there. They always have us checked in as soon as we come through the door. My entire family comes for medical care and dental care. This is not just a community, it is a family. This health community has not just given me and my family hope. Community of Hope has gained our trust. My husband and I are very proud advocates of Community of Hope, with multiple facilities meeting the needs of people all throughout the city. This facility will indeed create a health experience that is life-changing. We all desire accessible and quality health care. Additional to providing health care, we, Community of Hope, work hard to end homelessness. I'm so proud to share that in D.C. last year, we prevented or ended homeless for over 1,200 families. We are making Washington, D.C. more equitable in health care and housing. As a board member, this matters to us, the entire board, because this matters to our community we serve. So grateful to our funders, financiers, and friends who help us to achieve our mission daily. We know this is not a hospital. This is a community center whose focus is family health and birth. On behalf of the board, I want to say thank you. I want to say thank you to each and every partner and friend today who is here, everyone. So not just the people who are here just visiting and listening, but each patient, board member, everyone who's in the seats and standing. And you guys, it really, really does make a difference from the patient perspective, all that you guys are doing. And now I'm going to turn this back to Delia to do our closing remarks.
Well done, Heather. You know, catching that baby is an important job, right? Someone got to be there to catch the baby. But when you're going through that process and that journey of becoming a mother 1, 2, 3 times, you want to be embraced by people who love you, who support you, who feel like and know you are more than just your circumstance. You are more than your zip code. You are more than just a number. So thank you for really nailing down what this organization is all about. Thank you so much to Heather, to all our partners. You know, they're more than partners. They're family. Could you feel that? Could you feel that the mayor, that the partners who spoke, everyone is so proud and happy for what Community of Hope has done in this community and continues to do for all our neighbors. And so now, I know we don't want to hear me talking anymore. We want to see the building. But first, we need to cut the ribbon. So, if we could just have a few folks, I'm going to list the folks who joined us, and we will prepare to move over to our photographer and our shot for our ribbon cutting. Mayor Muriel Bowser, of course. Kelly is going to join us as well. I think you should be there. I mean, you kind of had a little bit to do with this. I mean, I don't know. Dr. Al Ballard, Community of Hope Chief Medical Officer. Is it Bellard? Bellard. All right. That's one pronunciation I didn't ask for. And that's the one I didn't get. Heather Reed Wise, and your family, please join us for the ribbon cutting. Giselle Amin, please join us and your team. Sonia Wells, Carl Malloy from Harbor Bank of Maryland, and Janine Jacokes. And after our ribbon cutting, the party begins. All right. Thank you so much for joining us on this lovely day.
Okay, on the count of 3.
Okay,
One,
ready?
2,